we're going to go ahead and get started. And my name is Paulina Sosa. I'm with the Latinx Voces en Salud campaign. I'm the founder and manager of the campaign. And it's just so exciting to be here with you all, and especially as we close out a very important month for many of us, Immigrant Heritage Month. So today marks the last day, and it's truly an honor to be joined by our wonderful guest speakers, Omar and Isabel, to really kind of close us out and give us some nuggets of wisdom as we look forward into the rest of 2020. So again, I hope everyone can hear me. If you have any questions or if you have any technical difficulties, please feel free to put it in the chat and we'll try to address those needs as they come along. So just really quickly wanted to share the format of today's event. So we are hopeful that today's event serves more of a conversation and an inspiration for everyone that is with us. We are also going to be moderating this panel session with Omar and Isabel, and but we want to encourage everyone in the call to also please submit your questions if you have any questions into the chat, and we'll make sure to include those in our panel discussion. So just a little bit about me before we start off today's panel discussion. I just wanted to say a little bit about how it's been for me in my journey of exploring my heritage and my identity as a Latina, as a Mexican American. And, you know, so really I, for years, never really embraced who I was. I never really embraced that part of my heritage. And really in the last 2 to 3 years, did it become clear to me how powerful and empowering it was to embrace my identity as a Mexican American. And so just doing so much, you know, research and looking into the history of my familia and, you know, our ancestors, and kind of going into the roots of Mexico and what is behind what it means to be a Mexican American has just been so empowering. And so I'm sure many of us are on a similar journey. And so I am actually launching a poll now, and we'd love to hear a little bit about your story before we get this conversation started with Omar and Isabel, and just a little bit also about the Latinx Voces en Salud campaign. As many of y'all can probably gather at this point, the campaign is an effort to essentially leverage and hear your stories. I think one of the things that I've run into a lot with not only myself, but with friends, with family, is that we don't feel our story really matters that much, or maybe we don't embrace our story as much as we should. And so this campaign is a grassroots effort to hear your story and to really kind of bring two different components that are generally not fused together: the world of public health and the world of the arts and cultura, and bringing those together into this campaign is really what we're doing. And so we're excited to share a little bit more about what we're doing at the end of this webinar. So other exciting events and efforts and initiatives that everyone in this call could definitely be a part of. So we'll be sharing more about that at the end of our conversation. But I also want to hand off the mic to Alejandra, who is really the reason why this webinar is happening. She has been the brains behind the Immigrant Heritage Month Instagram live videos. And so Alejandra, do you want to share a little bit with us on your vision for Immigrant Heritage Month and how that came about?
Yes, thank you, Paulina, and thank you so much for sharing that part of your story. And I really think that that is the whole purpose behind this whole project that we've been doing for the past 30 days. So every year, June is Immigrant Heritage Month, and I really think that because of the mission and vision behind the Latinx Voces en Salud campaign, this idea of raising our voices, sharing our story, and really embracing that storytelling in order to just amplify the power and culture of the Hispanics that we have in the US. I think that is the most beautiful thing about this campaign, and it's very unique to our initiative. And that's why I think Immigrant Heritage Month was the perfect opportunity for us to do this little mini series. For those of you who aren't completely familiar, we have had a mini series of Instagram live interviews for the past month, and you can definitely access those on our Instagram at Voces en Salud. And we really encourage you to fully be active and present in this presentation and in this discussion. And really, Immigrant Heritage Month is, and I really say this, that it is very important to me as a second generation Mexican American. You know, my father, he is an undocumented person who came to this country and met my mom. And so that is really how I came to be. And it's something that I really am looking forward to diving deep and sharing with you all. And I'm really excited to hear our panelists discuss their perspective, not only their personal, but also their professional experience in this topic. So thank you all for joining us.
Thank you so much, Ali. And again, a big kudos to Ali for getting all of this together. So as you all are filling in the poll, we also wanted to go into the bios of our panel speakers. And so I'm really quickly just going to do a quick bio before we jump into the panel discussion. But Isabel and Omar have just done such tremendous work in the field and with Latinx communities. And so it's truly an honor to have them both with us today. So just really quickly, I'm going to read their bios before we jump into the meat of today's event. So Isabel Garcia was born and raised in Tucson, Arizona, and is the co-founder of Coalición de Derechos Humanos, and retired as a legal defender in Pima County, Arizona. She has been at the forefront of immigrant and refugee rights since 1976. And so for those of us that know, immigrant rights and the fight for immigrant rights has definitely been a continuous battle and fight. So very much looking forward to hearing her perspectives on this. She has held press conferences, interviews, hosts media crews, leads demonstrations, weekly vigils, symposiums, and marches to draw attention to the needs and the gaps that are faced by immigrant communities. She works to counter anti-immigrant hysteria and to change stereotypes and misinformation about immigrants. Ms. Garcia has received many awards for her work, including the 2006 National Human Rights Award from the Comisión Nacional de los Derechos Humanos de México. So Isabel, it's such a pleasure to have you with us. And we also have Omar, who has also just done such tremendous work in the community. So Dr. Omar Contreras is a first-generation immigrant from Mexico with close to 15 years of public health expertise in state government and nonprofit sectors in the areas of community engagement, coalition building, health policy, and evidence-based research related to chronic and infectious diseases, which I'm sure, as many of you know, is a huge, huge issue in the Latinx community, especially even from my hometown, Brownsville, Texas. Dr. Contreras is dedicated to maximizing equitable access to health care to vulnerable communities by addressing social and political policies that impede optimal health. He holds a doctorate of public health and health policy and management, a master of public health and epidemiology, and is also the founding member of Contreras Policy Associates. So as you all can see, we have some really amazing speakers and panelists with us, and it's just exciting to get this conversation kicked off, especially in the midst of this pandemic that we're in. So without further ado, let's go ahead and get the panel discussion started. So I first just want to introduce both of the speakers to the group. And so if both of you could just tell us a little bit about yourself and your heritage, if you're comfortable even telling us about your story with immigration, we would love to hear that from you.
Thank you very much for having me here today and for engaging in such an important topic right this minute. I'd like to tell you about my father. I am, on my mother's side, a fourth generation Tucsonan. And on my father's side, I always say, thank God, I am first generation from my father. And I say thank God because, but for my father, I would not have attempted to deal with my identity until later in life, like you described earlier. I really had an education in my identity and my culture at a very young age. Mind you, my father came here when he was 24 years old, 3 years of formal education. And my father came here to move mountains. He not only gave me a glimpse of the Mayas and the Aztecas and Benito Juarez and how important Madero was, and going down further south to the Incas and all of it forming part of who I was. Not only did he do that for me, which my mother could not, but he came to benefit this entire country. And of course, most people would say, well, yes, they're farm workers, they're meat packers, they really lift up this economy. And yes, that's true. But let me tell you what else they do. My father came to lift the human rights of everybody. My father came to organize. He organized with 3 years of education. He organized the mine, mill, and smelter workers in 1956 in San Manuel and Superior, Arizona. Most people don't realize this, that it is the unions that created a semi-middle class in the Chicano, Mexicano community in this state. And yet, where are the unions today? And who is benefiting from the collective bargaining procedures that my father instituted? Do you know? It's the police departments, the corrections departments, the very people that were called in to bust heads during the 7 strikes that I lived through, that my father organized. We lived through those strikes. And so my father, imagine that, not only brought his back into it, my tios and my tias, you know, either constructing houses or doing the copper mines in this thing, but they brought a fight for human rights. It's my father who led, it's immigrants who led a lot of these struggles for better work. My father didn't limit himself either to just the mine, mill, and smelter workers, which he founded and he helped organize, but he became involved with the community. We have a park that finally was named after him, the Rudy Garcia Park, because when he was the president of the Little League, mind you, the Chicanos, Mexicanos had no place to play or practice. And he, under the threat of being arrested, began with the families, all of us included, clearing the big lot that is now was called the Rodeo Park. It's now called the Rudy Garcia Park. He fought for voting rights. He fought for education rights. He fought for binational rights. He was arrested in Nogales, Sonora, because he and we were distributing leaflets against Governor Jack Williams, who was being honored at a Fiesta de los Toros after he had sent tear gas the students in 1968. So I am so proud of the immigrant heritage that brought my father here, that made him be a champion, an unknown champion, right? Because he didn't champion to have his name on the park. It was named after Joe Gargiola. Imagine that. It was after the community heard me and found out that he had done all of this, that they named it after him. And it's because our community has come here not only to lift our economic boat for everybody, because they enrich my life. Immigrants enrich my life. They impoverish their own to enrich mine. How in the world can we treat people this way? And in my education with my father, of course, I became a lawyer. It was a natural thing, and healthcare, a very vital part of it. That's why I'm so happy that you're doing this and tying this to immigration and migrants, because migrants are at the low end of the receiving line of any kind of medical assistance, as you all know, and you're fighting for. So I'm really very proud of how my father brought this into me. So I didn't have an aha moment. My first aha moment was when I joined the women of Manzo. And then we began the immigrant rights movement here in Tucson, Arizona in 1976, when they raided the Manzo Area Council just because the women were giving out information on how to fill out your applications. And that, I was a first-year law student. I heard about the arrest on a Friday night in the news. I joined the Monday after classes, and I've never left since. And the Mujeres at Manzo have not left this struggle since then. I am now 67. I was 21 at the time. And so you can see that Tucson has a strong legacy of fighting what's been going on. And the militarization of the border, of course, has been our #1 target, because we know that militarization brings on death, suffering, despair, and disease. And so we have been involved in all of that. We've been involved in a binational effort with both countries in the time of COVID to take care of migrants as the most vulnerable population of all of us in this hemisphere. It is the migrants that have been forced out of their countries through other, things that we can spend another seminar on, but that are here and really need our services and attention. So with that, I'll just leave you for questions later, but my whole life has been enriched and defined by the immigrant experience.
Wow, thank you so much, Isabel. I mean, Mujeres Poderosas, no? I mean, wow, just such an inspiration. And I believe that many of our participants have also feel that inspiration and fire. So thank you so much for your story and just for making the good fight. It's definitely a leader for all of us. So thank you so much, Isabel. And Omar, we'd love to hear your story as well.
Sure, thank you. First of all, as I mentioned before the webinar started, it's truly an honor to be a part of this panel with Isabel Garcia. She's been a trailblazer. I'm originally also from, I grew up in Tucson, Arizona, so I know of Isabel Garcia and her work for a long time. So it's really an honor to be in the presence of these great leaders. I'd like to tell you, in contrast to Isabel, about my mother. I was born in Ciudad Juarez, and my mom worked for many years, and she's a product of the maquiladoras in Ciudad Juarez. As you know, that is very a prevalent aspect of Mexico's economy in the U.S.-Mexico border. So I saw my mom growing up working up to 2 shifts just so that she could make ends meet as a single mom, to take care of me at that time. It was until 1991, I was at 6 years at that point, that she decided to make the big leap into the United States and to migrate into Tucson. Growing up in Tucson was often challenging, given that as a newcomer, as a new immigrant, as they would call, el niño que no habla inglés in school, I was targeted, and I believe the target had to do a lot with not fitting in rightfully. And I think that's been part of the heritage sometimes that you feel growing up in a community that perhaps may not be as welcoming as you think of. But my mom did her best. She actually, she volunteered in our school, and she was there to help me throughout the way. And despite not knowing the language as well, she was also a great role model for me, because she always told me, she said, never forget who you are and where you come from, but never forget who has helped you in the way. Because as much as we are great, we're resilient, we get through many challenges, oftentimes we do have to appreciate those people that helped us out along the way. And for me, there has been many individuals that has helped me out. And even continue telling you the story with my mom. She, as we got to Tucson, as we arrived to Tucson, we came here with a legal crossing visa, but throughout that time that expired and we were undocumented. And, we were undocumented for about 4 years. And at that point, she did a very good job of explaining to me that everything was going to be okay without me actually knowing that that there was something not quite there. But I never knew any difference, because my mom always made the point of just taking care of myself. And at that point already, my younger brother was born. And she even had jobs where, for example, she worked in a tamale factory, where she worked there, and at some point they didn't even pay her for cleaning big pots and working extraneous hours. And going to some of the points that Isabel made about immigrant rights, they knew that she was an immigrant, and they still went ahead and exploited that vulnerability that she had. And I just remember just watching her, coming home very tired, similar to how I watched my grandma when I was growing up, because my grandma as well has been a great role model. She passed away in 2007, due to complications of diabetes, which we'll probably get on a little bit more about how diabetes is very prevalent in our communities. And I grew up with her going to, the Seguro Social, or how they call it in Mexico, it's IMSS, Instituto Médico de Seguro Social, and just going through her appointments and also seeing the struggle of how women are often so, well, not often, there always are trailblazers, and they always do the best to bring their families forward, and they're the matriarchs of the family. And I always saw that through both my mom and my grandma. And it was really challenging for me to see the struggles that they were going through. And in terms of my heritage, I always say that I am Latino, but I know that I'm Mexicano because I was born in Juarez. Though I'm a U.S. citizen, I always stay true to my roots. I am also, not only is it Immigrant Heritage Month, but it's also Pride Month. So as a gay Latino, it's also very important to take that into consideration of my heritage and how that has played into my professional aspirations, what I have been able to accomplish. But knowing that both intersectionalities of being an immigrant or being a member of the LGBTQ community are often a struggle to really understand, and knowing whether you're going to be accepted or not. I was very blessed to be to have a mother that just accepted me, and family members who have accepted me for who I am. But I know that that reality for many immigrants who are the LGBT community may not be the same. And so it's always been, I always feel blessed for that, and to share that experience with all of you. And I know that with my line of work through public health, in terms of studying chronic and infectious diseases, specifically how it targets Latino communities, populations of the U.S.-Mexico border, Arizona in general, it's been a really eye-opener, because I know that I and my family went through those challenges of ensuring that we had equitable healthcare, and oftentimes we didn't have that. We had to make sure that either we use the emergency department as a way of getting healthcare, or really just toughing it out, having that lo que Dios quiera, and he's going to take care of us, right? That fatalismo. But I'll leave it as that, so that we could potentially get into more of the questions. And I'm pretty sure that the health aspect and immigration we'll find our way through the conversation.
Wow, thank you so much, Omar. I mean, just hearing your story also is, double inspiration dose for me, and I'm sure for everyone on the call. And, it really gets me thinking too about navigating the border culture, because I'm from Brownsville, Texas, so it's on the border of Brownsville and Matamoros, and very different. And it actually brings to mind, I'm sure many of us have seen the Salina movie, and there's this one scene where the dad is saying, you're not Mexican enough, you're not American enough, and definitely that struggle and how to navigate that. That's definitely been difficult. And also, a shout out to all the single moms out there. I also have to give a lot of kudos to my mom, who really, if it wasn't for her and for her struggle and her fight, I have no idea where I would be. I would probably be a statistic at this point, especially on the border. So thank you both so much for sharing your story. I'm sure that it has resonated immensely with our group. And, I think, just as we were talking about this health and equity piece, I think it's a good transition to that part of our conversation. And so I would love to hear a little more from both of you about really what you feel are the most pressing immigrant health issues seeing in your community, but also, how the pandemic has really brought some of these issues that have normally been in the back, very much ignored, are bringing them to the front. And you both touched on this, the meat packing worker community, farm workers. I mean, there are some essential workers that really are the crux. They're the foundation of our entire system here in the US, but yet their health access is in the background. So Isabel, do you want to start us off with what you feel are those big immigrant health issues today?
Sure. Before giving it to Dr. Contreras to really get the answer here, But yes, especially during this pandemic, we have really peeled away, right, the covers that we have. And the covers that are hiding in broad daylight, really, our situation, which is that we have a labor force that a lot of it is undocumented here in Tucson as well, not just Phoenix. I know that we don't have, the grower, the that kind of industry, the growing industry, but we have a lot of undocumented people here, and they, exactly what you said, they're the essential workers. They are the ones that continue to get ill because they're the ones that continue to work, to feed us, to do all of our errands, to do everything that you are thinking of. In the healthcare industry, of course, we have many, many people. We have a lot of DACA recipients that are fighting for everyone's life in this country. And their situation is precarious. So even those that have, as the documented would say, they have a little bit more privilege too, in that they have education and stuff, but they don't have the privilege of documentation. Even they, right, are in the crosshairs right now. What we saw doing this letter, talking to people across Mexico and into here, we find that migrants, of course, are the ones that are not receiving any health care. In fact, are facing conditions by the very countries that are putting them in this condition. Look what the United States has done at our US-Mexico border. Have you guys gone to see or seen the pictures of? We have created refugee centers, refugee camps on the other side of the border unnecessarily. And so I ask myself, my gosh, what is going to happen there in terms of a health situation, right? There's a lot to say, and I want to hear from Dr. Contreras, but I think that we must pay attention to this issue of the migration. I mean, the conditions are so bad that, imagine, in 2011, I went to Geneva as part of a group to talk about how deadly borders are. And they finally issued a book based on lots of work that they did from other countries too, to make recommendations. And do you know that borders have been made dangerous by the very governments that are supposed to protect them? So I'll leave it at that.
Great. Thank you, Isabel. No, I would like to just, it was a great, to piggyback from that, is that I believe immigrants have faced a lot of numerous health challenges even prior to the pandemic. I think the pandemic has just exacerbated those health disparities that we're currently seeing across the migrant community, but also along the US-Mexico border. I'd like to bring attention to a couple of facts. I think that our farm worker community is deeply impacted, not only through already the disparities that they face, and also thinking that, farm workers suffer from poor health outcomes. They oftentimes have substandard working and living conditions, lack of money. How do they go about acquiring nutritious food? And I know about the farm worker community because I'm from Arizona, and so we have a large farm worker community in the Yuma area. And those disparities have just been exacerbated again by those underlying health problems that have been put by COVID-19. We further know that the lack of access to healthcare leads to poor health outcomes. If many times the farm worker community are also undocumented, and so the fear of them asking for further needs, basically for worker rights and human rights. They are frightened about what is going to happen. Is there going to be a retaliation in terms of they're going to be deported? And as we know, farm workers are here to really put the food on our table. There are essential workers. So most of the times, all our immigrant communities, those that are working currently right now during this pandemic, are classified as essential workers. And so when we think about us that are privileged to work from home or able to even host this webinar, we think about those communities that cannot. and so they have to go into work. They have to make sure how they're going to take care of their children, who's going to take care of them. Schools are out. How do I find support for our children that are staying at home? So having those thoughts and those aspects of what our farm worker community is going through is really also important. But also understand that even other underlying conditions such as our farmer community has been exposed to dangerous, pesticides. The association between pesticides and harmful exposures has been documented in terms of DNA damage. Are they higher rates of cancer and also other immunocompromised diseases? So it's really also important that we take into consideration what our farm worker community is going through. And Isabel touched on DACA. We really also have to pay attention to our DACA community, specifically the frontline healthcare workers that are the doctors, the nurses, the respiratory therapists, those that are in the front line of combating the pandemic. It's approximated that about 29,000 DACA recipients are in the front lines of COVID-19. So when we think about how what the administration has done, and I'm talking about the presidential administration, what they have done to not even provide any type of stimulus funding or aid for these essential healthcare workers that are on the front lines of protecting our communities, it's really disheartening and also frightening at the same time. And we really need to take into account and really thank them for the work that they're doing. And then we also have to take into consideration that mental health is a huge issue within our migrant community or DACA community. Anyone that faces that historical perspective and historical trauma, it's really important to take into account. We know that leads to higher levels of stress, which then leads to heightened levels of cortisol, which is a stress hormone. We know that end results leads to inflammatory diseases like cardiovascular diseases, which then leads to diabetes, which leads to on and on and on. So we really have to take into consideration that all these factors that are multifaceted, that are just coming at us from various angles. And so it's really important to think about that. And then if we talk about ICE, we know that many unaccompanied children are still in detention centers. We know that there was a federal judge just last Friday passed that, children should be released. And Isabel could probably speak more from the legal perspective. But we know that as of May 11th of 2020, there was 1,500 unaccompanied children in 195 ICE facilities. In one Chicago facility, 42 immigrant children had tested positive for COVID-19. And so, again, thinking about the situation that our communities are in these detention centers, are they really implementing public health guidelines to curtail the COVID-19 spread within detention centers? I don't necessarily know if that's true. They talked about CDC guidelines, but are we really there to ensure that is really going on? And we know that not only, again, are our communities and our families that are in detention centers, not only are they already facing historical trauma, stress, but also now you have an infectious disease of great magnitude that is just, just taking it to the next level. So we really have to, again, think about those issues that our migrant communities are facing.
Thank you so much for that. And I think, it's really enlightening and really disheartening to hear some of these facts that I think many of us know, but when they're in your face and you hear the percentages and you hear the numbers, you realize, wow. And like you said, what a privilege, the fact that we're able to work here from home, we're able to do this webinar and talk about these issues. But, one of my questions, just kind of to keep this flow of conversation going before asking the next question about health and cultural competence, which I think is a really big question a lot of us in public health and in healthcare are facing, is I would like to hear, and I'm sure the group would like to hear a little more about what these recent legal wins, as as it's being called a legal win. What happened in the Supreme Court with DACA, and what happened, with the judge you're referencing, and releasing these unaccompanied minors from detention centers. So I would love to hear a little more from Isabel and Omar about what does this mean legally, and what is the potential health impact of this on specifically on those people that are affected directly by these policies. So just wanted to continue that stream, because I'm sure many of us have questions about what does this really mean?
Well, I'll talk a little bit about DACA and the latest decision, but DACA, as you saw, was decided by one vote. I really thought we were going to lose by one vote, as the judge, Justice Roberts, I reviewed all of his comments, were really bad during his questioning. So something happened. Something happened that really moved him. And of course, it's all the documented. It's everybody who has done this. I mean, this is an example of what people can do. People with no power. You are a child. A lot of these were children. They weren't documented. Their parents were documented. Imagine in a society like ours that's stratified in all of this, with power, they took on the power, and this is what they were able to do. So it's up to the rest of us that we better fight. We better fight till they win. Now, we've got a little win right now, but it can be changed in a drop of a dime. If this administrations get reelected, we know where we're going. So we've got to be ready for a fight. That these young people came strong and countered the old Democratic Party narrative that, we have to be tough on the border in order to get legalization. The documented students just came out and stopped blaming everybody. They didn't blame their parents. They didn't blame anybody. They have the best political conscience of our entire society. So there's that. It's a continuous fight. We've got to support them, and we better put our bodies on the line if it comes down to that. The other decision is of course, about the release of the children. The Flores decision that was decided long ago said you can't be holding these children for over 72 hours, and we have been violating. Let's face it, we've lost everything when we began to do this to children in the open. Because yes, the Democrats and Obama were caging children too. Not to this extent, but the Democrats left too much of an infrastructure for Trump and these guys to now use against it. So now it's our job to open our eyes and to see the damage we've done, to see that we didn't need all these detention beds, that we didn't used to have all these ICE agents, we didn't used to have so many Border Patrol agents, we didn't incarcerate all these people, we didn't charge people with illegal entry, for God's sake. Those are all policy decisions we have made, we have allowed. And so now these court decisions are like a bit of a little glimpse of breath, because we could lose it in no time.
Thank you so much, Isabel. I think that's very, very informative for me to know. And I think, this is going to speak to what we'll do toward the end of this conversation. What can we do? What is next for those of us on the call? What are some actions we can feasibly take, whether it's from our home or whether it's on the ground or whether it's directly with our congressmen and our senators? So I definitely want us to have that conversation. And Omar, did you have anything to add to how these decisions kind of legally really have an impact on our communities?
Just to echo, what Isabel said, it's really true. We know that if this administration continues being in power, we are going to even suffer greatly. So I think it's really important as a collective voice, as a coalition, to really dismantle the barriers that are currently in place. And I think we oftentimes get told no, 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 no. I think all of us in this webinar have been told no, I don't know how many times. it's important for us to use that as a driving force for us to continue moving, to continue the momentum on how we could get out and mobilize communities to vote, to make the changes, because we do have that voice, and voting is so important even now. It's starting with our familia. It's really important that, how many of them say, and my vote doesn't count? Yes, it does. So we need to even start with our own home of how we view that move into the future. But other aspects I think that you talked about, Paulina, was about, policies. As you probably know, and Isabel knows very well, that, in 2010, SB 1070 was passed in Arizona, and that was also another exclusionary policy that was put in place in order for them to rightfully stop you from a racial profile type of case. We know that taking that policy into, which is still, there's been numerous things that have been already taken out of the policy, but other states followed suit in modeling what SB 1070 was in Arizona. And we know, again, that the ramifications of SB 1070 in all Latino communities have been very evident. For example, there has been a decline in social services utilization when we're talking about WIC, the Program for Women, Infant, and Children. We know that the utilization of healthcare services, it's still there because people are still afraid that a exclusionary policy such as SB 1070 is going to come back to them, and that's going to be used against them. We also have another policy that has been put in place by the Trump administration about the public charge. How do we go about, just because you need services or you're utilizing Medicaid or you're using something from like food assistance or SNAP program, that is a trigger for them to indicate that, because you have benefited, and I'm saying benefit in quotes, from government subsidized programs, that you are automatically not guaranteed for you to, move into your immigration process. And that's, again, attacked in health policy, attacked in legal policy, all around. So we have to keep also those things in mind as we think about policies, about all these little things that the administration have been doing behind and closed doors that we sometimes are not quite familiar, or that even our own state legislatures are doing, behind the scenes, that we oftentimes don't know until it may be too late.
Yes. Thank you so much for that. And I think, this really brings to the front of our minds, the fact that staying up to date with what is happening with policy, what's happening in our legal systems, both locally and nationally, are both equally important. And, I'm really happy that you brought up the point of voting and getting people registered to vote, getting them informed about what it means to vote. The census, this is also the year of every 10 years we have the census, and we know that Latinos are historically underrepresented and undercounted. And so how do we get people to informed and get them to fill out the census? And, that has actually been one of the goals of the campaign as well. And it really brings to light, too, what we're doing with the Latinx COVID task force. And you both touched on this. The reality is that Latino communities have a lot of other issues that they have been facing. You mentioned diabetes, mental health, the stigma around seeking help for mental health issues. And, there's all of these other things that have never really been quite at the front until now. And so I think before we kind of move into really kind of the last nugget of today's conversation around advocacy and getting informed, I want us to talk a little bit about cultural competence. And what does that mean? I think that we talked a little bit about the difference that there is inevitably at the border, right? Border health is its own culture. It's its own cultura right there. And, and then you have different states that have a different culture around, how Latino communities are and how they function together. And so there's a lot to consider in this. And so I know it's a loaded question, but I wanted to hear both of your thoughts on how we can culturally and competently, and let's bring in the language barrier that there inevitably is when it comes to public health and healthcare structures. How do we bring all of these pieces together, both in this fight against COVID, but also in our fight against other typical risk factors and diabetes and mental health issues that tend to pervade our communities?
Can I go first, Omar?
Yes, please.
Go first, Omar.
Oh, okay.
Yes.
I thought you said if I wanted to go first, or
Oh,
you going to go first. Sorry about that. I think we have to, there's a multi-pronged approach to this, Paulina, is that when we're talking about cultural competences, yes, we understand that culture plays a huge part of the way that we live, the way we socialize, the way we interact with people, and even oftentimes the way that we seek care. We know that, for example, growing up in a only Spanish-speaking home, I often took part in the translation aspect of with a provider and my mom, and oftentimes that I think that's a reality for many of us in the call, or many those of us who migrated or been in this country for a long time. And it's really important that culture competences also begin in the education system. We know that when we trained cultural competency in medical schools, when we train them in public health schools, nursing schools, physical therapists, you name it, across the health professions, cultural competences is not just about telling the student body, this is what cultural competence is. Yes, it's a major factor, but I think exposure is even taking it to the next level. They have to ensure that once you're going into your curricular, that you understand that there is a way for you to listen to your communities that you're going to be interacting with. If it's along the border, you understand that they're probably going to be monolingual Spanish speakers. You deal with binational culture. And so it's really important to implement those educational priorities with once you're going into health profession schools. But I also think it's really important that in order for you to address cultural competences, you also have to address systemic barriers and systemic racism. We know that now, given the racial divide that is occurring in our country, we have to even see more people of color, not only Mexicanos, Latinos, African Americans, American Indians, into the health professional fields. We have to make a better way of building that pipeline for students of color and people of color to go into these health professions, because they're just going to be, it's going to be greater, and it's going to be a bigger impact because they know what are the needs of the community. But what I mean about addressing the systemic racism is that oftentimes those programs and systems are not based for you to succeed. So you have to figure out a way, or we have to, I guess, us have to figure out a way to dismantle those barriers so that we make room for our young and bright and talented, people of color to go into these fields. And even in the legal aspect, Isabel knows all about of going into law school. We have to ensure that we build a sustainable system that allows students of color to go into these professions so that they could be that change and help dismantle that racism that is still occurring on in our healthcare system.
Thank you, Omar, because that really goes to the crux of my comments, which is I really think this entire country has to do a deep dive and undo and redo all of our history curriculum and history books. We must learn, and I don't understand why it's so hard to learn about warts and cancers. I mean, we're not perfect. You can't brush that away. And we have ugly parts of our history. I believe that we must, from K to 12, teach how we founded this country, that we came, committed genocide of indigenous people, did land grabs, that were founded on slavery, and then post-slavery structures. We have to learn the history of labor. Remember I told you about my father and the unions, and they're the ones who brought a middle class to this entire country. Nobody knows about unions and the labor movement. We don't know anything about immigration. We talk with people live at the border and they don't even know the history of immigration of these two countries. They have no idea how this country purposely asked Mexicans to come. We first discriminated against the Chinese. We did the Chinese Exclusion Act. We killed them. We lynched them. We need to study that. And of course, they needed labor, cheap labor. What did they do? Well, it was easy. They looked south. and they did a departmental order that permitted the introduction of Mexican workers without having to pay a head tax. I forgot to tell you that after the Chinese Exclusion Act, they said anybody that's coming in to work must pay a head tax. The company bringing them in must pay a head tax. They went and lobbied, of course, what they do now, and they got an exemption. Departmental Order of 1916 of the Department of Treasury, and they got an exemption to say what? You have to pay a tax unless your worker is coming from Mexico. Since that time, we've done a push and pull and push and pull. It's all based on economic forces. And so we don't learn any of that. And lastly, we don't learn the history of women. So it seems to me that we have to go deep into what Omar said, creating cultural competencies right now, right now. Getting our people in right now, but I think we need to do the long dive of changing all of our history book, because until we do that, we're going to be in the same boat.
Thank you both so much. I wish we could continue this conversation for another few hours for the rest of the day, because there's so much to unpack here. Like you said, Isabel, the history of women. We haven't even talked about in depth about mujeres poderosas. And the role of women in Latino communities. Omar, you've talked tremendously about the reality that there's a number of other health issues, including diabetes. And actually, I will go ahead and make this quick note too, that I was pre-diabetic when I was a teenager. I was heading down that road to be the typical statistic in Brownsville. So there's so many issues that we still need to unpack. And unfortunately, time is already closing in. So I know that there's a number of questions that we have received, both from the attendees and also that we had scheduled to talk about beforehand. But I think, a nice way to perhaps wrap this up and to hear your closing statements is to, first and foremost, how do we, each and every one of us, we all have a story, we all have a journey, we're all in a different location of this country. So how can we, both as participants and, fellow Latinos or allies of the Latino community, how can we continue to advocate for the needs and addressing the gaps that Latino families and communities are facing right now? What are some last nuggets of wisdom you would like to leave the group with before we close out today's session?
Well, thank you, first of all, for doing this, and for people who are taking their time to listen to this. I think that we need to do what we can from where we are, right? All of us have something to give. I know that some of us dabble in more things than one, right? I'm concerned about our educational system. So get involved in the educational system. I was involved in the Mexican American Studies Advisory Committee since its inception. I was concerned about the health conditions in Tucson of our Chicanos. So I joined the board of the El Rio Health Center many years ago. Wherever you are, you have something to give. And it seems to me that we are in a really important moment. Remember, sometimes it's just luck, a historical luck. A moment comes. Organizers will tell you, you try different things, right? But we are in a really historic time with what's going on, not only with COVID that has torn away the truth that we don't live American exceptionalism here. It's a big lie. We live in this moment. We're seeing the truth. We see who's essential. We have to see what's going on globally, that what they promised us with, free trades and neoliberal policies have not worked. In fact, have created more migration. We've got to wake up to all of these situations and be close to each other. Realize that the Black Lives Matter back then, when Benito Juarez and other people it was the other president who liberated slaves and said, you're going to come in here, where we have joint We have joint struggles together, all of us. We have to protect the LGBTQ in transition. That is the person that is most at risk. Transgender people in migration, we better wake up. So all of these things, I mean, DACA, we better stand up for these young people. We've got to stand up for each other. And I think we are at a moment when we can do it all from our own places, joining with others.
Thank you so much, Isabel. Omar, do you have anything to add? Any closing nuggets of wisdom for the group?
Sure. I always think that it's really important to find that cause that you want to accomplish in your life. You know, I often get told by my husband, it's like, you need to really figure out your cause and what you want to do. I think you're all over the place. And I think it's really hard for me to really just pinpoint to one thing, because we are very eager to just change the world. But in reality, we have to pick that cause. And I'm not saying just be the only cause. I think we have to start pinpointing of what that change you want to do in the world. And it's really important to pick one by one, because I think also times we talk about stress today, you know, we get so overwhelmed of wanting to help our community and how we could achieve that we lose track. And sometimes we get derailed on how we're going to achieve that. So it's really important, I think, for us to pinpoint and work towards that goal and what we want to change. However, I do believe that we are stronger together, and oftentimes I think we could be our own enemies. You know, the Latino community could be our own enemies, and we need to make sure that we stand in a collective voice. A strong coalition will really forge those initiatives that we want to accomplish, just to ensure that the safety and health of our community is at the forefront of these political leaders and those who are making these decisions, you know, for our future to come.
That's so powerful. Thank you both so much. Somos más fuertes unidos. And I think that, just like you said, I know that we're close on time, but just as you both said, you know, working together collectively, that synergy and finding how we can lift and leverage each other's stories and each other's causes, that is part of how we're going to see this change. And I really hope that we can actually continue this conversation at a later time. I think a lot of the attendees to this session would love to continue the conversation. We didn't get to everyone's questions, unfortunately. So hopefully we'll be able to continue the conversation, even if it is just offline. I also just want to say, you know, thank you to all the attendees. As we're talking about the prospect of storytelling, we also want to hear your story. And so actually within the next week or so, we will be actually sending out a call for submissions because we want to leverage your story. We want to hear your story around Immigrant Heritage Month. We want to, you know, even though today marks the last day of Immigrant Heritage Month, this is a year-round effort where we walk this journey of embracing who we are, embracing our culture, and walking this journey together. And so if you're interested, you know, please stay tuned for that information. We will also be doing a month focused on promotores and focused on the work that community health workers are doing tirelessly, especially during this time. So that'll be happening in August, leading into Hispanic Heritage Month. And Omar, Isabel, we'd love to, like I said, continue this conversation and work with you, even if it's during Hispanic Heritage Month, which is already around the corner. But there's so much history, and there's so much that a lot of us, I know, are hungry to learn about and are hungry to be a part of. So with that said, I won't hold you all for much longer, but I just want to say a very big, heartfelt gracias. Omar, Isabel, thank you so much. It has been such an inspiration for me, and I know for everyone in this webinar to hear your thoughts and to hear your fights and how powerfully you have impacted your community. Thank you again to all the attendees and to everyone in Latinx Voces en Salud and the campaign who've worked to get this together. And we will continue this fight. We will continue to do what we can to empower nuestra comunidad. So with that, thank you so much again, and we will definitely be talking soon. Mil gracias.